Okay, good morning, everyone. I want to welcome you to the Wednesday, November 1st, 2023 Paramedic Services Committee. Um, First item on the agenda is attendance, and everyone is present and accounted for. And we have Councillor Sicoli zooming in. Take us to item number 2 for this morning, approval of the agenda. Can I get a mover for that? Councillor Pierce, moved by, second by Mayor Bailey. Does anybody wish to see anything added to that agenda? Okay, seeing none, all in favor of the agenda? Okay, none opposed. Declaration of pecuniary interest. Let me know if you have anything, whether it's now or in camera. Oh, Mayor Davis, go ahead.
Yeah, thank you, Mr. Chair. That in-camera matter involving the new ambulance station. I have to declare a conflict on that, an indirect pecuniary interest, because I also sit on the board of Grand Bridge Energy.
Okay, thank you very much. And the clerk has noted that there will be a pecuniary interest on that. Anybody else? Okay, see none. We'll skip number 4, no delegations today, and we'll go to item number 5, and that's the adoption of the minutes from the September 18th meeting. Can I get a mover for those, please? Councillor Martin, seconded by Councillor Sicoli. Comments, questions, errors, omissions? See none, all in favor? Okay, any business arising from those minutes? Okay, seeing none. We're going to go to staff reports. Item 7.1, decommissioned ambulance vehicle donation. There's a recommendation. And Russ, is there anything you want to add to it before we? I think it's straightforward, but
through you, Mr. Chair.
How are you?
Through you, Mr. Chair. This has been done from other paramedic services throughout Ontario, and it's a goodwill gesture to other countries that cannot afford an ambulance. Working with our other suppliers right now, they will help us outfit the existing older stretchers that they currently have that have been decommissioned. They will add, we have decommissioned bags that we can provide them in good working condition and some of the stock that's required. I just think it's the right thing to do for somebody that's this nun/ER doctor has asked us many times over the last 3 to 5 years. And none of the vehicles we had at that time would be suitable for them to do. The ones that we would be sending right now were about 250,000 kilometers, which is basically end of life for a frontline vehicle for us. I would recommend it would be the right thing to do, and we could also get some public PR around it from what we're donating to them.
Okay, any questions for the chief? Go ahead.
Just a comment and a question, I guess. Regardless of the public PR, I think it's the right thing to do. Now, we're not involved in any of the payment for the shipping of this thing across. It's just the ambulance itself, and then they worry about all the shipping costs and all that kind of stuff.
Through you, Mr. Chair, our only contribution is the donation. They would sign a release of basically our assets to them, and after that, right, the transportation of it being in a container ship is on them. But we're giving them basically a readily stocked ambulance, maybe minus a monitor and stuff, that could be shipped out.
Great idea. Thank you.
Okay, any other questions? Okay, there's a recommendation before us. I'll need a mover to get it on the floor. Moved by Mayor Bailey, seconded by Councillor Pierce. Any other comments or questions on that motion? Okay, all in favor? Okay, all opposed? Well, I hope they put it to good use, and I think they will. So, okay, that'll bring us to item 7.2, and that's the paramedic services statistical package. And looks like it's a little bit better than when we first met earlier this year. But Russ, is there anything you want to point out on this before we take questions on it?
Through you, Mr. Chair, there's a few things on this that are basically more glaring to us. On page 11 of the statistical report, we now have new data, way of looking at things. We knew we were losing hours to our emergency department for the amount of vehicles that are lost. With our new enhancement to our SAD dashboard, basically our situational aware dashboard, we can see how many vehicle hours we are losing daily in the emergency department due to offload delays. So that chart, it says lost hours per day. We just received the data on October 3rd, and this takes us to October 24th. So on average, we will lose 39 hours, 24 minutes, and 47 seconds in this snapshot of vehicles on a daily basis in the emergency department for offload, and we are currently staffed 204 vehicle hours every 24 hours. So on average, if you look at it for the last 24 days, we lost 15% of our vehicle hours sitting in emergency department. Now, the province has provided us the additional back hallway funding of $628,000 to provide them staffing. Our last meeting with the Brantford General Hospital that we just had, their commitment is to launch 24/7. We went through the vacation time in the summertime, we went through fall, and to launch fully as of basically November 15th to cover our cold and flu season. And if additional funding is still available, they would also put on an additional nurse from noon to midnight to help out in the event we do transfers to lessen this 15% loss even greater for us. But the other hiccup that we cannot measure right now is the amount of delays we may have as they go through construction. So we're losing some of our areas. For the most part, I am now been invited by the ER staff to sit on their charge nurse meetings, just giving them an update of what our crews can and cannot do. And when you do walk down the hall during the day and you see 7 ambulances on offload delay, and then you go at 3 o'clock in the morning and there's 7 ambulances in the hallway, the difference is those 7 at night is all we have. During the day, we only have 10. So the urgency to get our crews back out of there, and if you can see some of the response times that we have been decreasing our time in ER, but this new data, we can monitor it daily. The snapshot is taken at 9 a.m. every day. Some days, if you look at 3 o'clock in the afternoon, we lost 72 hours, but it averages through the day. It's taken at the same time every day. So I just wanted to point that out. The other thing I wanted to point out was from Councillor Martin from the City Council meeting. One of his questions was about our cross-border billing, that has it decreased. Last year, with the increase of the ambulance additional vehicle right now, we went from 1,991 times relying on our neighbors. We've cut it into 50% right now, and we hope that improvement will go better. I've also found out that the province has repealed the legislation for cross-border billing. It is up now to us as a service to contact our existing or our basically bordering services to relook at our current agreement and basically work towards no further cross-border billing if we can get that far in our agreements. So that was from the question that you asked at the meeting back in the middle of October. So those are my 2 updates that I can provide you right now dealing with the statistical package.
Okay, thank you, Russ. Any questions for Russ on the package before us today, before we get on the floor? We'll go to Councillor Martin first, because your name came up earlier, so go ahead.
Thank you. I know working in Toronto when we ran medical calls, a lot of times the ambulance spent a lot of time with the patient before loading and taking to the hospital. Is that something that's done here?
For further clarification, could you give me an example?
Well, taking blood pressure, taking temp, take all the vitals, and then additional things over and above that. One in particular, they tried to put an IV into a baby, and they spent 15, 20 minutes trying to get it started. And I was about to tell the parents, tell them to stop because they weren't going to get it. They just take them to the hospital where somebody there can if it's needed. But,
through you, Mr. Chair, right, they do what's required by legislation, by the Ambulance Act, right, to stabilize the patient before moving. Okay. Each and every call is different, but with the additional training, our ACPs, our IV training right now, right, I have 150% faith in what our crews do, and they do what's needed on scene, and also to expedite the urgency to getting them to hospital. So it's not that the protocols have changed. It's by legislation of what you need to do before you leave. You have to basically get your baseline of vitals and stuff like this, right? If an IV is required to dealing with boluses and stuff, that's their medical judgment at that point in time. If at any time they have questions overall with their treatment, they have full access to a physician to ask the questions. To, as you said, it was taking too long for that IV. Maybe the crew needed additional medical clarification, but they do have access to somebody 24/7.
Yeah, just in that case, they could have been at the hospital before, in the time they spent trying to start the IV, they could have transported the patient to the hospital. It just
Correct.
seems kind of silly to be spending all that time when, within that time they could have been at the hospital where there'd be better equipment, better staff.
Not knowing the details, it could have been a sugar issue for the child at that point in time. And the longer you wait for a child in more of a diabetic emergency, right, the more damage you do. So not knowing the parameters around that case, but it's all basically protocol based. And I have 150%, as I said, faith in our crews, what they do.
I'm not questioning our crew at all.
No, for what's outlined, through what's outlined through the base hospital and their requirements.
I didn't realize that was all legislated. When do we expect the increasing senior population to stabilize and reverse?
Through you, Mr. Chair, it's basically, from all the reports we've looked at, is till 2029.
Okay.
So we're still about 6 years off, and I believe I've added that in previous reports from the demographics, and the overall about 2029 is where we anticipate to stabilize.
And how long before it starts to reverse?
They guesstimate, and again, it's a guesstimation, 2032, 34.
Okay, thank you.
Hopefully we're having a meeting that we're all here for that next meeting.
I'm feeling younger already, Councillor Pierce.
Me too, Mr. Chair. Thank you very much. Through you. Couple things. Yeah. First of all, just looking at the numbers, they're definitely, there's a big change in them, which is interesting in itself. Couple things. So if we look at the lost hours per day on offload, and then we try and link that to the time on task minutes. I know the two of them are kind of linked in a little bit. But if we look at our time on task, we seem to be ahead of 2022 at this point in time. Now, does that factored in with this new data that we have? If we look at the overall call volume being down, do we feel that that's a factor in there? And you spoke with Councillor Martin earlier about the cross border. The cross border being cut in half. If we look at our call volumes over the last month or so, they seem to be down a little bit too. Do we think that's a factor, or do we think have we done something to different or changed, or has something changed across the broader spectrum to get our numbers down to where they are? And I'm not complaining. Don't get me wrong. I'm just it's nice to see, but I'm just curious. Has something changed, or have we done something different?
Through you, Mr. Chair, it's a multiple of things. This council and this group basically providing us an additional vehicle. The stats last year, we were at 115% capacity. Adding that truck, we were basically at one point in time this year down to 87% capacity. We're working with the hospital directly. The additional backhaul nurse funding, everybody is working together to get this done. And right now we're showing about a 6 to 7% reduction from last year in our call volume. So everything is contributing. If I had this lost time hours a year or two ago, I believe not with the excessive amounts of offloads we had last year, these numbers of losing 15%, I would only guesstimate that we would lose 30 to 40% of our vehicle hours sitting in Emerge. So everybody in every department from Emerge to our group here to our paramedics, everybody is working together to get them out. So that time on task, as you referred to, if you look, we went from 59 down to 52, now down to 48, right? So that is now time on task with a reduction on lost hours in Emerge. That brings that down as well for the time on task. So that 92% capacity will be able to fluctuate from 92 down to 87, and it will always be fluctuating. If, like London right now, we had another 32% call increase, we would not be able to meet that capacity, and we would be having to look at other ideas and avenues.
Thank you for that. One more, if I could, Mr. Chair. With circling back to the lost hours per day on offload, this is very interesting data. Are other regions, other paramedics using this as well? Because where I'm going with this, and I know, it's sometimes like talking to a stone, but like, is the province aware of this data from multiple, like we're not the only ones that have these issues. And I'm just wondering if paramedic services in general across Ontario could use this data to, to take it to the province to say, hey, we've got an issue here all over the place, and we need help.
Through you, Mr. Chair, Chief Sanderson in Hamilton, him and I work together, and he's our president of our OAPC. So where some of this data that has come from is his group develops it and then shares it outright from the province. He's basically our direct spokesperson for the province. We're dealing with the offload delays. This is where some of the funding has come from for the more dedicated back hallway nurses. They are aware of the issues in the time that's lost. But if this type of data, if we could have measured it last year and showing improvements, the money that the province has given us is well spent. But everybody that has the SAD dashboard through our electronic patient charting system has access to this information.
Interesting. Okay, thank you.
Any further questions for our chief? You see, now I'll ask a couple questions. Going to a bit of a spin on what's already been asked, but to Russ, in Toronto, if there's no ambulances available, they call it a code red, I believe, and that's the same as our code 0, correct?
Correct.
Okay, so when Toronto has a code red, I see it on the news, and I think that's a good thing because I think it helps it gets the message out there that these situations exist. And if I know Toronto, sometimes they think they're the center of the world, but if they have that code red, which is our code 0, it helps get the message to the provincial government. So I think actually, in a way, it's a good thing for us that gets out there. I wanted to ask about that new graph you showed us on page 11. And if we look at October 4th, you see that's the peak, 72 lost hours, versus say October 23rd, where looks like it's about 3 or 4 hours. Is that a combination of a busy ER, say on the busiest, where we lost the most hours, a lot of ambulances on the road that day, and a busy ER, or in other words, can you point to what was so bad on October 4th versus October 23rd? Have you drilled down to that?
Through you, Mr. Chair, it's a multiple of scenarios. As I showed you in my last report, that colorful graph that shows reds and greens and blacks and stuff, is dealing with call volume. It could be dealing with ER staffing. It could be dealing with our staffing if 4 people called in sick and we couldn't staff a vehicle. That all contributes to the 72 hours on that specific day. Like last night, we got a call from Emerge that basically says, we don't have a charge nurse, we're down 2 nurses, and your vehicles are going to be extensive offload delays. You may want to upstaff. At least working together, giving us that heads up to basically prepare for long delays. Last night, it never came to fruition. We basically only had like 7 lost hours last night. But again, working together. If they're short, we're short, we work together to try to not manipulate it, but to manage the situation for 24 hours. So yes, it's a contribution of multiple things. Last night we anticipated another spike, but it never came to be. Through you dealing with these questions, I was contacted by a reporter that says, what could you do out in the community? And I think Mayor Davis and Councillor Pearson, everybody in this group have said this before. What can we promote out there in the community for them not to call 911? So what we've basically said to this reporter, it says, if you call an ambulance, it doesn't give you priority access, right? It doesn't give you priority service. That if you come in there with a sore stomach and it's not urgent, they can put you in the fit to sit. They will put you in the waiting room as similar as if you took a taxi or had a family member. Before you call 911 look at your healthcare provider. If you don't have a healthcare provider, look at urgent care. Take your flu shots, get your COVID shots. Anything you can do not to call us. And that was part of her overall questioning and promotion to move forward. So that was part of your question.
Okay, thank you, Russ. Okay, I'm gonna get this on the floor. Can I get a mover get the report on for Councillor Martin? Seconded by Mayor Bailey. Okay, any further questions? Okay, all in favor? Okay, opposed? None. Okay, communications, we have none. Other business, there was none brought up. Nobody has anything? I will bring up one other thing because we're going to lose Mayor Davis once we go to the in-camera because I think he'll head out. But I just want to talk about the meeting schedule for 2024. when we first started, things were quite dire. Maybe not so much now. So we will probably look, unless I hear otherwise, at going back to the quarterly meeting. Does anybody have any input on that?
May I say something?
Yeah.
If you do it quarterly, preferably at the end of the month, because if we do it at the beginning of the month, we lose, like it takes us about 14 days to get the data from, say, August. So if we have it on the 2nd of September, you're not going to get August data. We're always going to be behind. So if we do it like mid to later of the month, you'll get within the data within the 30 days that just passed.
Okay. And if I look at our clerk, Nancy, I know sometimes, well, yeah, versus we don't necessarily have to go to the beginning, but it's nice, or it's nice. The ambulance minutes and recommendations follow into our council package at the end of the month. So maybe we can get it towards the end of the month, but still get it so that we get it into the council meeting for the month. Okay. Go ahead, Mayor Davis.
Yeah, I understand why we might want to consider going to quarterly because of the nature of the information we have here. It doesn't really change that much from month to month. But what about our budget process? It's pretty tight. I'm not sure our ability to follow the established protocol between the city and county. If we're only meeting quarterly, I'm not sure we'd be able to meet those timelines. Like we have to, I think, approve the budget by September, I think it is. So would there be a variation or adjustment in that quarterly schedule to accommodate the budget process? Like, for example, would we have maybe a standalone meeting to deal with the budget in August or September, or July, or whenever?
Yeah, the clerk has indicated we could. I'll let you go in a second, Russ. And I do know, and we could do what we did again this year, is call a special meeting just to deal with the budget that we couldn't deal at the regular meeting. So, Russ, did you want to?
No, I have
Okay.
nothing on that.
So you believe we can make it? It shouldn't be an issue. Okay.
So what I'd ask you might consider doing is, I assume you're going to be sending out at some point calendar invites for the entire year. Can you put in there a special meeting date for the budget, which I guess would be what, in June or July or August? I'm not sure. Probably August, isn't it?
Certainly, staff will work together and we'll get some dates proposed and then send out meeting invites for the year.
Okay. Yeah, so I can vote in favor of the proposal because, of course, you do have the ability as chair to call for an ad hoc meeting if it's required.
And I don't need to point that out because we all recognize that. But I think, well, I know for the past year we tried to. The regular meeting was scheduled to deal with the budget, but we also had an extra meeting scheduled. So if that's the case, we'll meet the timelines. I'm not sure. But as of for scheduling itself, I know our clerk has to work with the city clerk and their social services, and there's John Noblehome that also meet on the Wednesday. So it can be a little bit tricky, but I'll let you guys deal with that, and we'll go back to the quarterly meeting unless I hear otherwise. Okay. So with that, I need a motion to go in camera, please. Councillor Martin, Councillor Pierce, all in favor? Opposed? Oh, sorry, Gary, was I talking and we weren't live? I just have such faith in you, Gary, that you're so quick. So, anyways, okay, yeah, speaking to the next meeting, and we'll leave that up to our county and city clerks to coordinate all that. And with that, I'd like a motion to adjourn, moved by Councilor Martin, and we are adjourned. Thank you very much. Thank you, Russ.
Thank you. I think we need